Welcome and thank you again for joining us today for the American College's webcast, Planning in a Crisis, Caregiving and Long-Term Care Transitions. I will be your host today, Kaylee Ranck. I am the director of the college's Office for Research at the American College, and I am joined by my esteemed colleague, Joellen Meckley, who is the managing director for the Center for Special Needs. And so with that, we will go ahead and talk about why we are doing a whole entire presentation on the crisis planning for caregiving and long-term care. Long-term care planning tends to be one of the most overlooked aspects of financial advising and planning, especially because many clients avoid thinking about their own decline or the needs of aging family members. However, crises such as strokes, falls, or rapid cognitive decline can instantly thrust individuals and families and caregivers into a situation without any warning. These events not only have those emotional consequences, the time and the commitment that goes into it, but they also carry massive financial implications. And so essentially for all of the financial professionals on this call, this is a critical inflection point for a lot of individuals and families. And you're likely going to be one of the very first calls that they make, not just because you have been in their life, obviously, or maybe a doctor, maybe not, or an attorney, but because money touches every portion of this decision that they face as they enter into this crisis. Whether they're the patient or the caregiver, you really do have a unique ability to move clients through this process, not only with their wealth, but their relationships and ensuring that their legacy stays intact. So we are here today to help you with some tools that will kind of streamline that process. And so one thing I would like to share with you is that the majority of our presentation will be facilitated and will be guided through utilizing the checklist that we have provided for you in the chat. This is a checklist that Joellen and I have created to essentially walk through some key components when you are faced with a client who is needing some assistance with the crisis when it comes to caregiving responsibilities and some unexpected long-term care. So as we know, this matters mostly because there is the onset of chronic illness, any kind of disability or unexpected trauma can certainly trigger these long-term care needs well before retirement or unexpectedly during retirement or sooner than a lot of clients have expected. And what we know about any of these kind of traumatic long-term care health issues, they can be really detrimental to any retirement plan that has been created, especially if there hasn't been a real active or proactive approach to planning for these long-term care needs. And what we're here today is to help you walk through maybe how to deal with these crisis situations, because not all is lost. There are things that can be done to help protect the families that you're working with. And really, it shows that the role that I think a lot of financial professionals play is beyond that of the asset manager, of the money manager, but really that you can help be that navigator in times of this transition, helping clients protect their dignity, reduce family conflict, and avoid some of the irreversible losses, the financial losses that include some of what happens when there's missteps to certain financial decisions that drain retirement savings, that can force the sale of a home, or disrupt any kind of estate plans that were intended initially. So really, this is all about prevalence. I mean, we're on the call because, quite frankly, that this is a quite a prevalent issue among a lot of individuals, and certainly a large portion of a large generation who's dealing with caring for aging parents as well as children, part of that sandwich generation, and having to split a lot of these times. We know that 70% of people over the age of 65 will need some kind of long-term care during their lives, and that of those 50% are going to need paid care because it really is beyond the scope of what an informal caregiver can truly provide. And that for a large portion of them, you see that they're going to need it for longer than just a temporary state, but that it can last for 2 years, and that there are advancements in technology that allow individuals to live longer, but sometimes live longer, but also in poor health, making that caregiving responsibility last much longer, both from paid care, but also informal care or spousal care or family care. What we know is that 53 million Americans are providing unpaid care due to sudden or unexpected events, such as those strokes, falls, hospitalizations, or rapid cognitive decline. And that we really do see that there's also a cadre of individuals who experience some level of disability or are in need of long-term care prior to being eligible for Medicare. Just for reference, we will not be going into detail about that population today. We are going to predominantly focus on those over the age of 65. So this is the scenario that we're going to be working with today. So when you look through that checklist, this is an example of what would happen perhaps if you're in your office, you get a call from a client, they're experiencing some situation. This is the situation that we'll be referring to as we walk through some of the components that are really element and key and fundamental to providing that holistic support service. So the crisis that we have is that Tom and Linda Thompson have been married for decades. They're in their mid-70s. They live in a suburban home that they've owned for over 30 years. They have it completely paid off. Tom recently suffered a moderate stroke that required hospitalization and is now transitioning to skilled nursing facility for rehabilitation. Linda is in relatively good health, and in fact, Tom was prior. So this came on slightly, like completely unexpectedly. They had not anticipated that they would be in this situation. However, Linda is really struggling in understanding what to do next, especially because they had not done any real planning when it came to thinking about caregiving responsibilities. So she needs advice, both financially, perhaps legally, and even logistically on what's next. So their financial picture is that their house is paid off. They have a value of $550,000. Tom has an IRA in his name, and that is valued at $350,000. Assuming he is over the age of 73, he will be collecting some RMDs. There's a joint brokerage account at $400,000. Social Security is what they're currently really living off of, and it's in the amount of a combined amount of $3,800. They do not have any long-term care insurance, no life insurance with long-term care rider. So they are really at a loss currently, and she needs assistance. And more importantly, they also have not updated any of their estate documents for over 15 years. So where do you start? I think what's so important here is that it's not just all about financial products or what to do next. It's really about being maybe the connector, the educator, and the advocate for the client. And really where this is the triage support. It's about collecting some basic information in this first stage to maybe guide their client, Linda here, on what to do next. And it's important to recognize that you clearly don't have to have all the answers. Sometimes that first initial call, as many of you have experienced probably, it's really just about having somebody listen and then maybe have like a first step, a second step, like what can I do, or know that somebody is listening. And so if you do a lot of this pre-planning that's included in this checklist, and I think Joellen will really talk about those centers of influence and connecting externally to create this process where it might be a little bit easier. So that's all kind of done in a pre-plan work. So when clients do come in with these kinds of challenges, some of those resources that you would need will already be available to you or listed out so that your clients can reach out to those resources in your community. So as you can see from the worksheet that we've provided, there are some key questions for your client throughout the whole kind of process of dealing with this initial stage of the crisis. So as you can see, I'm not going to go through each of these bullets because this will be discussed in each of the slides. And so we will show kind of how it looks based on that case study. And I will allow Joellen to kind of walk you through that first part.
All right, so in our checklist, again, the checklist is meant to be something that will trigger you to think of every question you should be asking during that client meeting. The client is stressed out. They might not even know right now what they need to be thinking about or what they need to know. So the whole point of us creating this kind of like guiding document is so that you also kind of as the more calm advisor here in this situation are thinking through everything that maybe you don't need to know, but maybe the attorney they're working with needs to know, or the home care agency or the hospital even needs to know. So it gets kind of the wheels turning. So as with any client intake interview, we're going to always start out, with preliminary questions. So, who are we planning for today? You may get called from clients where it is a wife in this situation calling about a spouse. You may have a longtime younger client who is calling you because their parents need, assistance with a crisis and they just don't know who else to go to for advice. So again, are you reaching out for yourself, for someone else? Um, Quick basics about the current situation, the person who needs care, how old are they? Are they living alone? Are they getting any public benefits already? Do you know anything about their current health or long-term care insurance, their documents? Is there anyone else involved in their decision making? If there are extended family members, adult children, et cetera, who are involved, you want to know that kind of right at the outside of the call. And then basically, like, what's your main goal today? What's stressing you out the most? What problem can I help you solve? And that's, your preliminary questions at the outset. Okay, so then we're going to move on to the next phase of the checklist, which is the immediate medical situation and the care needs. And again, at the outset, you are not a medical professional. You don't need to understand anything about the medicine, the issues, at all in this, but you do need to understand the very basics of that. So first off, where is the client now? Are they currently hospitalized? Are they in a rehabilitation or other sort of care facility, or are they at home? Another big one that you're going to want to ask about is the prognosis. And I was thinking about this as I was preparing this. I should have said at the outset. So my background, I was a practicing elder law and special needs attorney before I came to the college to run the Center for Special Needs. And then prior to that, I was a nursing home administrator. So based on that, I've come to realize, and I'm not a clinician, but there are sometimes some difficult conversations you have to have with people in order to help them plan financially or plan legally. So something, especially in an acute medical crisis, that can be a difficult conversation is what's the prognosis. So sometimes you need to dance around this conversation a little bit. In this situation, if I'm on the phone with Linda, who we already know from our facts is really struggling, she's stressed out, she's scared, etc., I may get the vibe during that call that maybe I don't want to really press her, like, hey, what does the doctor think? Does the doctor think Tom is going to recover from this, or is he going to be permanently disabled? That might not be the right time. But maybe if Linda's daughter is also on the phone with you, you can say, can I follow up with you later if I have other questions, et cetera? And, can I call the daughter instead of Linda to, take some of the pressure off? So, you kind of have to gauge the feel in the moment as to how to ask that question. And the reason why we're asking about the prognosis in that situation, which the doctors may or may not even know prognosis, is because you as the financial planner need to think about what is the likelihood that they're going to need either, short-term rehabilitation care after this and then care at home, or long-term care. Um, and you want to start researching that right away. That's why we ask the prognosis right away, is because these things don't get set up overnight. Even if the person is currently hospitalized and they're not sure when they're going to be discharged, if it is likely that they're going to need to go into a rehab facility, you want to start helping your client or letting your client know they need to start researching or looking for a facility right away. Because when the time comes for them to be discharged to the facility, a lot of times you get 1 day's notice. Okay, so this may seem like common sense, but I don't know what the comfort level is of everyone who's on the call today. So in a crisis with an older adult, the typical pattern that you're seeing is there is some sort of issue that is causing an acute hospitalization. This is things Kaylee said earlier: the fall, the stroke, injury, medical instability, or a sudden mental status change. They spend a few days in the hospital, and then depending on the hospital will make the determination if they are safe to return home or not. Is the home a safe environment? Is it set up for them? Do they have access to home care? If not, and if the college thinks they are eligible for rehabilitation, a lot of times folks are going to have that middle step where they go to a skilled nursing facility that provides rehab care after the hospital. And I put in big parentheses there, if eligible, because there are qualifying factors. The two biggest things to qualify for Medicare Part A, okay, so let me take a step back. Medicare Part A is going to be paying for the acute hospitalization phase. Medicare Part A will also pay for rehab if they are deemed eligible. To do that, your first threshold is they need to have been admitted to the hospital for at least 3 days. That may sound very straightforward, but in today's day and age, it actually isn't, because there's a lot of times when older adults go into the ER, and because there's not beds available or because they're not really sure what's going on, they get admitted for what's called an observation stay. That is not admitted. They are being held there under observation, and it does not meet Medicare Part A's requirements in order for Medicare to kick in and pay for rehab afterwards. So if you're getting the call from the client saying loved one is in the hospital, we're not sure what's going on, keep this in mind and make sure that they are talking to the doctor, the social worker, the discharge planner, et cetera, about the 3-day rule. And then on top of that, they need to have, in order to get rehab, they have to demonstrate a need for that, which is a skilled need, which what that means is wound care, IV nutrition, injections, unstable volatile health situation. That's considered a nursing skilled need. Or a skilled need can be physical therapy, occupational therapy, speech are the 3 types of therapy that they might need. And that all needs to be required in order for Part A to pay for that. Then after that, they may be going home straight up from the nursing home and they're ready up and at it and they're good to go. They don't need any home care at home. But a lot of times they still need a transition time at home. And so that would be ongoing home care, or if home is really not set up for that, sometimes they're going to stay a little bit longer in the facility, even after that rehab stay is completed. And that's something you need to bear in mind, because again, that is going to be a major cost factor. And I have had many clients, families call me over the years where they're saying mom or dad is in rehab. They're saying she's maxed out her potential in rehab. Medicare Part A is going to stop paying at the end of this week, but we don't feel like she's ready to come home. That's why we talk about facility-based recovery. Now, of course, home care also, and you don't need to have a complex understanding or deep understanding of Medicare to understand this, but understand that both Medicare Part A and Part B do cover some amount of care at home. But again, there are limitations, and it's also going to differ whether or not they have original Medicare or Medicare Advantage plan. So these are all things to just, it's issue spot. You don't need to be an expert. There are other professionals you are going to be able to tap into that are going to help figure out the nuances of what is going to pay for which stage of their long-term care. All right, so now the living situation and support system. This is the next kind of phase of our checklist. And again, it is never too early to start thinking about this. What is the living situation and what is going to be the support system at home once Tom, in this case, hopefully graduates from rehab and is able to come home? So if it is the client's goal to return home, first you need to think about the suitability of the home environment, and you need to think about, is there any family or social support that is there to assist directly with the care themselves, physically hands-on, or assist with coordinating outside caregivers, which can be a job in and of itself. Kaylee could speak to that. She's been dealing with something in her own family and is a caregiver coordinating care from a distance. And this is a story that I think probably many of us on this call have dealt with. So you want to be thinking about that. If there is no support at home, there are professionals that you can reach out to that can help kind of problem solve and set up care in those situations. So obviously home care companies that you get referred to by the hospital discharge planner or the nursing home discharge planner, they will often offer some degree of care coordination and kind of troubleshooting at home. But there is also another type of professional. They used to go by the term geriatric care manager. Now the preferred term is aging life care consultant. And I'll be giving you some resources to look those up later. But those are folks who can be an absolute godsend in a situation like this where you are making the transition from one environment to another. They'll come out and do a home assessment. They're going to know all of the local home care agencies. They're going to understand durable medical equipment, what insurance will pay for, what it won't pay for. How do you set up a wheelchair transport to go to a doctor's office if the loved one can't get in the car? So these are where you need to have your toolkit, and your toolkit is going to consist not only of your own knowledge, but it's going to consist of the professionals that you've gotten to know, you've established relationships with, and you can call them in a pinch, in a crisis. And again, can't emphasize enough, start planning for return home as early as possible because planning and coordinating those resources takes time. In our case study, we're told that Tom and Linda lived in the same house for 30 years. Telling you right now, in that type of situation, I can almost guarantee that their house is not well equipped for someone who is aging in place. If it is a two-story house, those bedrooms are often on the second floor, and that alone, especially if we've got someone who has mobility issues, is going to cause a major crisis. So now we've got Tom recovering from his stroke, but he's sleeping on the couch in the living room downstairs. There may or may not be a shower or a bath on that first floor, or even a bathroom, depending on the age of the house. So um, that is one of the reasons why you need to start planning early. Again, you're not going to be able to maybe make home modifications right away, like renovate or sell their house and move to a more appropriate living environment, but there might be band-aids that can be put on the surface to set them up, for example, in a first floor room until you can come up with another option. And again, in this situation, the case study is telling us that Linda is overwhelmed. This is a perfect area where you can step in and start carrying some of that emotional burden, because Linda is going to be thinking about Tom. She's going to think about her spouse of umpteen years and the fact that he has had this medical crisis. She is not going to be thinking about, who do I call to get a chairlift installed so that we can get up to the second floor. So that is one area where you can be of tremendous support. Okay, so legal and decision-making authority. So time is, I'm talking a lot of time is of the essence. It's a crisis, so time is of the essence probably with all of these different things. But the critical documents piece truly is, again, a time is of the essence, but this is not something that you're going to do alone. This is a lot of times when I would get a call from a financial planner who was trying to bridge support, for their client who's in crisis. They would call me because they'll say, oh, she thinks she has a power of attorney, but she's not sure how old it is. She doesn't know if it works. We're not sure if it includes healthcare powers, etc. So during this intake call, it is essential that you ask them, is there a durable financial power of attorney in place? Is there an advance directive in place? An advance directive just means a healthcare power of attorney and a living will. You might also hear it referred to as a healthcare proxy. These are just terms of art that are used differently in different places. Then your next question is, so if these are great, if these were just done last year, if they went to elder law attorney down the street and they've got documents that are a couple of years old, fingers crossed, they're buttoned up, they're in great shape. Or if you've done your job as a planner and made sure that they had these documents done, they're in great shape. If not, then our second question is, does the client have sufficient decision-making capacity to communicate, make their own decisions? Do they have the capacity to execute either first-time documents now because they don't have them at all, or updated documents? Now you might think, oh, they've got a financial POA, they're good to go. Unfortunately, that's not true. The laws have changed a lot in many, many states over the course of the last 10 to 15 years. For example, many, many states now require that if there's going to be if the agent under the power of attorney is going to be making any transfers or gifting away assets, which again, when we're talking long-term care, Medicaid planning, things like that, you need to make sure that whoever is in control of the assets has the authority to actually transfer them, the ownership of them, to someone else. A lot of times that has to be spelled out explicitly in the document. So if they got their POA from Staples, and took it off the shelf and signed it, it might not have that authority in it. The elder law attorney, this trusted elder law attorney that you're going to find, and we're going to tell you how to find a good one, is your best resource to advise. And then the attending physician is the one who's going to help assess whether or not the client has sufficient legal decision-making capacity. And your takeaway there is to understand that capacity is not black and white. It is transient. Someone can have good days, bad days. They can have capacity at one time during the day, and then it may fade a little later on when they're tired. It can be transient, and that's okay. As long as that attorney is a good attorney and understands that. And they're also, you understand there's different levels of capacity that you need to have to make certain legal decisions. In this situation, I can't tell you the number of times that I have gone to someone's hospital bed after getting assurance that they do have the mental capacity to indicate to me, yes, I want my daughter to make these decisions for me. I want my daughter to pay my bills for me. They can do that. That's sufficient capacity. They might not even be able to hold the pen well themselves. But if I can document that, yes, they knew what they were signing, but yep, the daughter held her hand on top of dad's hand and guided it and helped steady it so that he could sign, or he can only sign with an X. And now I have attested that that X is his signature. It all works. The worst case scenario is guardianship, and that is the only legal path that can be taken if someone lacks capacity and it does not come back. They can't sign any new documents and there's no power of attorney in place. So now we've got a real mess, especially in a crisis situation because someone is having to file paperwork in court.
Yeah, Joellen, before we move on to the financial overview, there was a question in the chat that I think is relevant for what you were just going over. It said, should the durable power of attorney be springing into like action based on a specified event, or is it just effective immediately?
So my practice point, there are a power of attorney can be either springing or not springing. What springing means is that there is some sort of language in there that says, this power of attorney, for example, my agent may only begin taking over control of my finances if 2 doctors have attested to the fact that I lack capacity. Okay. A lot of times people will say, oh, yeah, that sounds good. I don't want anyone taking control of my stuff unless I'm really, really need it. However, as an attorney who's done thousands of these at this point, I typically would do everything in my power to talk someone out of doing a springing power of attorney because all that does is gum up the works. It slows things down. You may have a hard time getting that medical documentation and you need to go to the bank tomorrow to access the bank account. And the line that I typically said to clients when they said, no, 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 I think that's the kind that I want, I would say, okay, we'll do that if that's what you really want. But if you don't trust that agent today, now, if you don't trust them immediately to manage all your affairs and have access to all your money, why are you going to trust them when you no longer have capacity? So if you're going to name someone in that document, it shouldn't need to be springing. That's my personal take. Obviously, it can be one way or the other.
So we'll be transitioning over to the financial overview and some of the planning concerns. So when we are looking at the crisis that Tom and Linda are experiencing, we see that Linda's most pressing issue and immediate financial concern here is really that, can we actually afford doing this care for Tom, especially if when he returns home, she is unable to or cannot perform the duties that are needed in order to provide additional care. So getting additional resources in the house, because it is not covered it's not a skilled thing. So it's not covered by Medicare. It really falls under that long-term care piece. And that the other concern really is, what if he declines further and needs additional care or more advanced medical devices and other support services, and especially as she is physically aging and maybe becoming more frail as she ages with his disease. So a couple of really important things is, do they actually have the capacity to manage their money during the immediate crisis? So the short answer is she is completely capable of managing her money based on what we know about Linda in this particular case. Now, if for whatever reason there was cognitive decline on her part, then there would have to be some other options in how the money gets managed, whether or not, and that's why that pre-planning piece is so important. And what's wild is that although this is a crisis, it's an onset, there are things that you can start to do that include some pre-planning. So while she is able to currently provide a lot of this additional care, also she can manage their money and do the things that are necessary. It's an opportunity to maybe set in place some options that if she were to decline and that they needed additional people who would serve in that capacity. And so it actually serves for some components of proactive planning for the future. I think looking at the client's current budget, including any excessive monthly incomes, like what can be redirected. And as you can see, based on this current situation, there's going to have to be some Medicaid planning. And I know Joellen will kind of walk through what that looks like. But given the fact that all of their stuff is titled together, with the exception of Tom's IRA, that is only his, if at any point he needs care that well exceeds their resources, it really leaves Linda in a very precarious situation, especially if she's going to outlive Tom by a decade or two, and then if their resources are utilized. And that's for his care as opposed to hers for the future, and the importance of that asset protection, which Joellen will kind of walk through the best avenues to go ahead and do that. And then what kind of strategies need to be identified that can be liquidated or used to pay for care, and what are going to be the best strategy to do that. And for example, in this case, there is an opportunity for Linda to actually hold on to some of those assets. And there is a way, even in this crisis, to be able to protect a portion of that if you are doing some Medicaid planning. But there's a likelihood that they would end up having to use Tom's IRA, and that would probably be strategy-wise one of the best things to start with, as opposed to the joint brokerage account. And Joellen will walk through the nuances of that and the importance of why, when we're even thinking about that financial piece, the importance of having an elder attorney walk you through ways to asset protect, and then also strategize about where to pull the money from first. And then also as things change with home care and custodial care. And so with that, I am going to turn it over to Joellen to talk about the importance of that Medicaid planning and asset protection. And then Joellen, when you walk through that, I will have a few questions that did come up in the chat that are somewhat interrelated. So.
Okay, thanks, Kaylee. So again, your role as an advisor here is to help protect against risk. That is one of your roles. And this is a crisis. So we're not doing proactive, Medicaid planning in a situation like this. But again, this is not an area where you need to be an expert. You turn to a qualified elder law attorney who is going to understand the legal nuances of this. This is not something that should be dabbled in because the rules that need to be followed to do this effectively it's really critical that you follow them, and they differ slightly by state. So again, in this crisis, the reason why we think about in this particular case study asset protection planning is because while Tom and Linda have done a good job of accumulating that IRA, accumulating that joint brokerage account, paying their house down, etc., they're in their early 70s or the mid 70s. And even if Tom's health is not good and his prognosis, maybe his life expectancy is not good, Linda is going to live. And so live longer, most likely, we hope. So we need to make sure that she doesn't run out of money someday. And that's the way, that is. Now, everyone might not, some clients might be like, nope, we're paying it. We're not going to get on public benefits. We're not interested. That's fine. But you can help them understand the implications of it. And one of those is helping them understand the risk. If Tom does not recover enough in this situation to come home from the nursing home and resume living at home, you are looking at assisted living at best, or possibly nursing home level custodial care, which is not covered by Medicare at all. So that cost can run, in my area, a long-term care facility is $12,000 to $15,000 a month. I live in southern New Jersey outside of Philadelphia. Other parts of the country, it's a little bit more affordable. So in this situation, depending on that prognosis, you need to begin considering, is Medicaid a possibility down the road? And if so, understand that even in this crisis situation, if you have a married couple, this is not a asset protection seminar, so I can't get into all the nuances of it, but we're just going to talk about a married couple. You can protect just about everything for that healthy spouse if you do it the right way. And that is the takeaway here. You're not going to save everything, because unfortunately assets will need to be liquidated and converted to cash. Assets will need, so they can be used to purchase, for example, an annuity, or the IRA may have to, if they do need some private pay money, you're going to use that IRA first, because if it is the IRA of the sick spouse, that is the most difficult asset to protect, because it has to be cashed in if it is going to be protected. So you're going to have tax hits. You're going to have some early withdrawal penalties, potentially. You're going to have liquidation costs. But just the takeaway is that you do want to start thinking early in a situation like this one about getting that advice, so we can hopefully preserve some money for Linda no matter what. So then we'll move on to paying for long-term care. So this is your basic overview of how do you pay for long-term care. Again, then we're reiterating some of the concepts that we've talked about. You're going to hear it a couple of different times, but again, a reminder. Medicare Part A only pays for short-term rehab in a facility up to 100 days. And now that's another key sticking point here is the 100-day thing. A lot of people will think, oh, I've got 100 days. Good. I've got some breathing room. I've got all that time to sort of put together our plan. It is up to 100 days. And in order for them to get as much as possible, the facility needs to determine that this person can keep progressing and that they're continuing to need a skilled care. It is not uncommon, especially with an older adult who maybe has some cognitive issues, that they stop cooperating with therapy at some point. And if they are refusing to go to that physical therapy appointment every single day, guess what? The facility is going to say, listen, we can no longer justify billing Medicare Part A for their stay. If they're going to stay here at the facility, you're going to need to switch to private pay. And they usually give you a few days notice of that. It is not a lot of time. So this is something that you want to make sure the client understands and is keeping in very, very close contact with the discharge planner and the social workers and the nurses at the nursing home to see like how much longer do you think Tom is going to still be qualifying for rehab? Don't have Medicare Part A, here's your 4 options. Private pay, writing a check for thousands and thousands of dollars every single month. Long-term care insurance, if they were smart enough to purchase a policy when they were young. VA benefits, if they're a veteran, there's terrific VA benefits out there. If you have a service-connected disability, that's a certain, percentage service-connected disability. There are nursing homes in your area that the VA will pay for all of your nursing home care. Most people don't know that. There's also VA nursing homes in a lot of different states. In my state, they're fantastic. And there's actually waiting lists for people to get in, old vets to get into these homes. And then last means of last resort is Medicaid. If you are eligible, we're not going to get into eligibility rules here. That's for another day, but that is your last resort. So role of the advisor is to help your families evaluate their assets, their income, their benefits, and develop a plan. And you involve other professionals to ensure there is a holistic approach. All right, so here is your quick and dirty on Medicare. So Medicare Part A, as we said, covers inpatient and acute hospital care. Medicare Part A also covers short-term rehab in a skilled nursing facility up to a max of 100 days if patient meets qualifications. Medicare Part B does not cover long-term residential care. Medicare Part B is your medical insurance portion of Medicare, but it does cover some forms of home care, PT, OT, speech. Medigap, this is only for those who are enrolled in original Medicare. It's to cover the things that Medicare Part A and B does not cover. It is not Medicare Advantage. Medicare Advantage plans, often more affordable, so we see a lot of clients opting for these. They vary based on plan, based on region, etc. They often include non-traditional services, which is great, including transportation and medical appointments, some home modifications, meal delivery, etc. So I sometimes have mixed feelings about Medicare Advantage, and the reason why we didn't say this on here is that not all rehab facilities take every Medicare Advantage plan. So when you're in that hospital and discharge planner is like, okay, I need to know by tomorrow what type of nursing home or what nursing home you want Tom to go to, that Advantage plan may not be accepted, the rehab that you fell in love with on the tour. So you need to know, again, as those tours are happening and you're talking to the facilities, you need to understand what type of Medicare they have. What does Medicare not cover? It covers no custodial care unless there is also a skilled care need. And even then the coverage days are capped for Part A. It is limited to part-time skilled services for home health, and a doctor needs to have certified that you are homebound. Now, homebound doesn't mean you literally can't leave your home. It means that you can't leave your home without the assistance of a device or another person. And last point, average out-of-pocket cost for families needing extended home care post-discharge is $4,500 to $8,000 a month. That's from Genworth. So it's no joke. You can see how quickly, if someone is not taking the time to start thinking through these things and problem solving early, how quickly you can deplete someone's savings. Okay, Kaylee, why don't you do the insurance coverage review?
Yeah, so I do want to, so having what type of Medicare for clients, like it really does impact some of the decisions that come next. We did have a participant ask if Medigap pays for any long-term care, and it does not. So Medigap is essentially an extension of original Medicare. The way Medigap generally works is that if there is out-of-pocket expenses, Medigap covers that. So whatever Medicare would cover, it really only covers the out-of-pocket expense that would have been provided through Medicare. So it does not cover long-term care. It is essentially a similar exact benefit package that you would have with original Medicare. So it does not. You would need a separate plan. And while Medicare Advantage plans do cover some additional support services, that also depends, and it's for how long and for how much. It really can be quite costly, as Joellen noted in the previous slide. So I think one of the really important components here is the long-term care piece. Like, while we know that Tom and Linda do not have long-term care insurance of any kind, it's really important to know if a client has it. And sometimes this will be probably more nuanced if you are the one who has provided the care for the actual policy for your client who then needs the care. Obviously, you would have a little bit more understanding as to the actual policy. However, what we see often in the industry is that clients will shift to different practitioners and they will take their policies with them. And so really truly understanding kind of specifically what it is you're looking at is really important. So for example, what types they have. Do they have just traditional long-term care insurance, which is essentially you either use it or you lose it. You pay for it. It provides a certain amount of money or a certain amount of time. And then there's a host of the exclusionary time, so the amount of time it takes before the policy actually kicks in, and understanding whether that's a 60-day, how long, and then what you are going to do with your client in order to cover that coverage during the time before the policy actually takes effect. If they have a hybrid policy, this is a policy where it is often tied to some kind of annuity and a portion of it is utilized for long-term care benefits, or it then ends up being rolled into death benefits. So this idea around selecting what is most effective for clients, it is costly. As we know, for our case study clients, Tom and Linda, they're in their 70s, and obtaining affordable long-term care policies at that stage is very, very difficult. And so really that's a conversation that if the client actually were, like, say, for example, their children, maybe considering having conversations with them about at a future date around their own plans and practice at that point. I know Joellen went into some of the veterans benefits, which are really beneficial when it comes to the long-term care. And then, of course, we're not, for the purposes of this presentation, we're not really communicating about individuals who are under the age of 65. However, there are some clients who, in fact, are still employed after 65 who maybe end up in some kind of crisis situation. And what some of them have had access to is some short-term benefits, either through disability, if the intention is that they're not going to need, as Joellen had mentioned, the long, whether it's a short-term or long-term rehabilitation time, that can offset some of those costs, at least initially. And then, of course, does any insurance that they currently have, is it really adequate for, their medical costs? And then how do you get to a point where there is enough to actually make sure that your client or your client's family member is covered?
And also understand that as their medical needs change, you can change your Medicare plan. You can get a different Part D plan. You can do things now to adjust to the changing situation.
Right. And so this is essentially what I kind of started talking about before. So what are the monthly, daily, and the lifetime policy limits? All of these policies are generally sold with all of this already written in place. And so making sure that, especially if your client has a policy that you did not sell them, that you truly understand the mechanisms of that. And if they don't, to contact an elder law attorney who can walk through. And I know Joellen can communicate about some of the challenges that many of her clients and practitioners have faced, the financial practitioners, because there are so many nuances to some of the long-term care policies. And then for how long is it good for, what services are covered, and then what is that elimination period? It's really just modeling out these scenarios and ensuring that you're utilizing the most cost-effective use of the benefit. And actually there was a question in the Q&A about reverse mortgages. And actually, while it's not on this slide in terms of paying for long-term care, that is an option. But I think Joellen will talk a little bit about why that might not be the best scenario in this case because of like Medicaid asset protections, particularly since there is likely going to be a surviving spouse that at some point may need care herself. And so that is an option, but it really depends on the family situation.
Okay, so yeah, and I'll just actually, even though this isn't on this slide, so with regards to the reverse mortgage, sometimes, yes, that's something you want to, that's never going to be my first solution to jump to get access to cash unless it is the only real option, because again, that's a great asset that you want to try to protect. It is a very easy asset to protect in the context of Medicaid planning if you're going that way. In a situation like this, if we thought there was going to be significant care costs, I would rather go through the process of doing asset transfers, buying annuities, et cetera, meeting the rules for Medicaid qualification when you have a married couple, and protecting the house because the house is an excluded asset. They're not going to take the house. It needs to be retitled into her name. Alone, but they're not going to take the house in this situation. So the reverse mortgage, again, if they don't care about leaving a legacy, that can be a great source of cash, but it's tread carefully. So I'll go through this quickly because we are in our last 10 minutes here. So again, talked about powers of attorney earlier, living will, end of life instructions, your last will and testament, any trusts. These are all key documents that you're going to want the client to locate, dig out, and either get to you for review or get to the elder law attorney that you're going to be working with. Also think about deeds and beneficiary designations. This is a big one. If you've gotten them the life insurance policy, if you've helped them with their IRA, make sure they know who the beneficiaries are on these documents. If, for example, Tom, say it was Linda who had the IRA, and Tom, or has a CD, anything that has a beneficiary named on it, and Tom is the beneficiary, you're most likely going to want to take him off the policy, because if we're getting him onto Medicaid and Linda unexpectedly dies first, then he's going to get that money and he's going to lose his Medicaid benefits. I'm sure she would rather that money go to their children if they have them. So beneficiary designations become really, really critical, because I can't tell you the number of times that healthy community spouse up and died before the sick spouse did, and we had an inadvertent Medicaid issue. And obviously their insurance policies. Make sure they know what's in the documents, where they are, and do you and the attorney have copies of them? Okay, next one, talk a little bit about caregivers, Kaylee.
Yeah, so this is really, really an important component, and that is the fact that for a lot of caregivers, there's a lot of undue stress that is held upon them, whether they are a spouse, whether they are a child, whether they're a friend or a family member. One of the biggest things is whether or not the spouse is actually capable of taking on those caregiving duties. So often we see that a lot of spouses say, yes, I'll do it, I can do it all. And then there's a lot of burnout. There's also a lot of physical ramifications a lot of times for caregivers. What we also see is that the financial impact for caregivers, on average, over $7,000 a year is what an individual caregiver will spend of their own money on care for another person. So that's a huge impact, particularly for individuals who maybe are stepping out from work, taking some FMLA to care for a family member. And it is particularly important for individuals who are in the accumulation stage of their retirement. So having real conversations about it is also providing caregiving, but what is that impact on your own retirement, your own financial future, and thinking about that cost benefit analysis in terms of the true financial cost around caregiving, because it is not just about the time and that $7,000 spent. It is also about missed opportunities for matched contributions if you're stepping out from employment for 6 months to a year, and then the time value of money for the next 20 years that it would be accumulating interest. And so there are some really important things to consider. And then also resources on it, and we will provide this also at the end, some resources for challenges for caregiving and emotional support teams that exist, support groups that exist for caregivers, and then community resources that exist. So outside of kind of that financial piece or that legal piece, but really the holistic emotional side and the toll that caregiving can take on an individual and a family and a partnership. And then I would actually say one of the last components to that is if you are a caregiver, get ensuring that maybe there is a caregiving agreement in place, particularly if you are providing care and want to have resources exchange hands. And this is particularly important when it comes to if you are Medicaid planning at that point. So because some of those funds that are given in good faith for the care that's provided sometimes looks like a gift and needs to be paid back prior to Medicaid being Medicaid eligible. So those are some considerations and some documentation that needs to take place. And then, of course, keeping those professionals on your team, really, really important. Obviously, Joellen could not have probably provided even better indication of how important having an elder law attorney on the team is, or having somebody that you can communicate with, having somebody who does aging life care management and care consultant, having an accountant, which I know a lot of financial advisors, that's a big part of their centers of influence. And then, of course, having a Medicare or a long-term care insurance broker to be able to communicate questions with.
Okay, very quickly, I'd rather jump to the questions because there's some really great questions in here. We just wanted to highlight, these were some of the things that jumped out to me as the biggest red flags in the planning situation. Again, no powers of attorney, diminished decision-making capacity, red flag, alarm bells going off, call the attorney. Outdated estate planning documents, beneficiary designations, this is a crisis. You need to get this resolved ASAP. There's a high anticipated cost of care and absolutely no funding plan. If you spend 3 months writing a check for $15,000 to pay for that private pay care, that's a huge chunk of money for Linda in this situation to lose. Red flag. Family conflict, a lack of identified decision maker, siblings living on opposite coasts, and the one who is nearby is handling all the work, but the one who's on the opposite coast feels guilty, so they're constantly interfering and second guessing decisions that are made. Get an attorney involved, get a mediator involved. They don't understand their current medical insurance, or if the house is ill-equipped. Those to me are your biggest red flags to look out for right away. And then on here, the links are not here, but they're going to be in the slides that are sent out to you. On the Medicare.gov website, there is a nursing home compare search that you can look up all the nursing homes in your area, including their quality ratings. Go to the National Association of Elder Law Attorneys. There's an attorney search. This is where I go when I want to find a reputable elder law attorney in another state. Someone asked that in the questions, are there any in Houston? Yes. And what you want to look for, that you don't have to. Now, I was not a CELA, a CELA certified elder law attorney. I never sat for the exam. I should have. But if you really want to guarantee that it's someone who's an expert, look for the letters CELA after their name. Aging Life Care Association website has a care manager search by zip code. Same thing. There's different tiers of them. You can look for the best. Your local area agency on aging is a great resource. We put a link in the slides to a long-term care cost calculator tool that you can use through Genworth. And then we also put a link to some caregiving support services. So let me quickly jump through some of these questions. Let's see here. Okay. If you don't mention or suggest long-term care insurance, can you be held legally responsible for your client's long-term care? No. You're maybe not doing a good job as an advisor, but they're not going to hold you legally responsible for it. Many long-term care policies will not pay a family member as a caregiver. That's true. What's the best way to handle this type of situation financially? In that situation, what I would consider is, maxing out the long-term care policy on other things, or you don't have to spend it all at a time. You have a lifetime limit. You can slow roll it and spend it a little by little over time. However, if the loved one, if your parent, for example, has money that is available to them, work with an attorney, work with an elder law attorney. You can put in place something called a caregiver agreement, and you can legally pay your child for care and have it not be treated as a gift to them. But again, you have to dot your I's and cross your T's. Thank you for the person who inserted a new link. We talked about reverse mortgages. Todd said nursing homes in my area often require some period of private self-pay before they allow you to stay on Medicaid. Unfortunately, that is sadly more and more the situation. That nursing homes require that. That is another reason why you're going to want to work with a care advisor and an elder law attorney in the area who know all these facilities. But this is something that goes into the financial planning aspect of it. Is sometimes I'll say to clients, listen, you're going to have to be prepared to spend $100,000, $200,000 privately to get your loved one into this facility. And it's just a sunk cost. You have to do it. And then after that, we'll do the Medicaid planning and get them switched over to Medicaid. Someone asked about optimal age, I think, for applying for long-term care insurance. Kaylee, what are your thoughts on that? In the 50s, early 60s at this point?
Yeah, I did respond. So the most economical where you get the lowest monthly is usually around your mid 50s. But you can still purchase affordable like up through that early 60 stage where you can start to like look at the cost benefit analysis. But post that, it starts to get too costly. Like at that point, you're edging on self pay.
Yeah. And so question was, any resources for when a person is losing capacity to manage money matters? So again, I feel like I'm beating a dead horse. Talk to an attorney. If they have the family member, this is when you're going to want to make sure that someone is named as their power of attorney and is doing that. If they don't have a family member who can do that, there are some accountants, at least in my local area, who will do like a bill pay service and things like that for someone who is losing capacity. And then if they really are out of luck, have no family members, no power of attorney, et cetera, in some courts in some states will allow a protected kind of state that is something lesser than a guardianship, but is someone who is just at risk of being financially vulnerable, financially exploited. And then you can have a court-appointed individual who takes over managing their finances for them. Unfortunately, none of these are an easy solution. They're just not. These are difficult conversations to have. I already talked about how to find the best elder law attorneys in the area. CE code, you got it. For special needs attorneys, if you're looking for a special needs attorney, my go-to is the Special Needs Alliance. In my opinion, those are the best special needs attorneys in the country, and there should be a few in every state. And if they are part of the Special Needs Alliance, it means that they are a true expert and they have been invited to join that group. There is also the Academy of Special Needs that you can also find attorneys through. Daryl, techniques to help manage family dynamics and strong emotions. I think we need a whole other session other than that. We don't have time here. Let's see here. I think that's good. I think we hit it all then. Thank you so much to everyone for attending. I think the interest that you've all shown here is telling us that maybe we need to turn this into a series because it's a lot of good information. We appreciate your participation, and sorry, because we are over time, I'm not going to be able to take any other questions than what we saw in the chat. So I hope everyone has a great day.
Expand your opportunities at theamericancollege.edu.